Hi, I'm your host, Marsha Florence for Just Ask. Today our show is Social Security Administration. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today our show is the Social Security Administration, and we have our returning resourceful information person, O'Brien Robertson. He is the Area Work Incentive Coordinator. Hi, O'Brien.
Hi, Marsha. Thanks for having me again.
Thank you for coming back. Now, you know what? We're so used to having you guys come and see us, and basically it's because you always bring some helpful and supportive information for the community at large. So I know that the Social Security Administration is helping out with a new division or a new program with Medicare.
Yes, there's really a very exciting new program that starts in January, and your viewers will not want to miss this. Okay. They won't want to walk away from the screen yet.
Okay. Now tell us, you say in January, we're talking about January 2006. Okay, and what will this program be?
Well, the Medicare prescription drug program is brand new. Medicare's never had a prescription drug plan. So this is going to help people pay for prescriptions that they've never had help with before. They're going to be able to save a lot of money. And for many, there's even extra help available to lower the cost. But people who will have to apply for that extra help, and it's applied for separately.
Okay. Now, how is Social Security involved in this?
Well, it is Medicare's program, but they've asked Social Security to help with this extra help or assist with this extra help program. And just like they've asked a lot of the pharmaceutical companies, the insurance companies, to help with the prescription drug plans, and I'll be talking about that in a second. But everybody in this country is helping pull this all together so that people who need prescriptions, seniors and people with disabilities who need prescriptions, they're going to get a lot of help with this in the cost savings.
Okay. Now I'm going to back up a little bit because a lot of people may not know what a work incentive coordinator does. So tell us a little bit about your role in the Social Security Administration.
Well, what I do is help people who have disabilities understand that it's okay to go back to work. That there's a lot of programs with Social Security that reduce the risk, that allow them to keep their Medicare, Medicaid, work, and still get their Social Security or SSI benefits.
Okay, now last time you were here, we talked about that, and
right.
That is one of the major components of Social Security, for the agency with the state of Michigan and many more that assist persons with disabilities. Because a lot of people were under the impression that if I go to work, that they're going to cut my benefits off, no medical coverage, no anything.
That's all old.
That's good.
There's new and exciting programs. The Ticket to Work program, I think we discussed that.
Yep.
There's a lot of ways, but there's a right way to do it and a wrong way. And what I do is give training to Social Security offices in the area, from Port Huron to Monroe and as far west as Ann Arbor, and give training to agencies and groups that advocate for the disabled.
Okay. Well, bring us up to speed on the Medicare program, and we talked about earlier off camera that a lot of people want to save money, so this should be an ideal program for helping persons save money. So give us an overview of the Medicare program.
Well, there's 4 parts to Medicare.
Okay.
Part A, B, C, and D. That's easy to remember. Medicare Part A, we pay for that while we're working. 1.45% of our paycheck goes to Medicare. In fact, if you ever looked at your pay stub, there might be an HI on the check stub. That's not the federal government's way of saying hi. That stands for hospital insurance.
Okay.
And there's a deductible every year of $912, but it pays for the hospital stays.
Okay.
Now, there's also Medicare Part B, as in boy. It covers 80% of the doctor bills and outpatient medical expenses. There is a deductible of $110 per year for Medicare Part B. But in addition, we pay for Medicare Part B when we receive it. So there's a monthly premium of $78.20. Medicare also has an HMO. They call it the Medicare Advantage program. So if somebody is in their program, this new prescription drug plan will be included in their HMO with Medicare. And then the new program coming out January 1st, 2006, and that's the new prescription drug program. People are going to love it. It's going to save a lot of money for people.
Now, is there an age criteria dealing with that?
An age
Criteria? Is there a certain...
Well, yeah, Medicare is only available for people who are 65 years old
Okay.
or older. But you can also get Medicare if you have a disability benefit from Social Security.
Okay.
You can get Medicare. It kicks in about 2 years after your benefit starts.
Okay.
There's also Medicare available for people who have kidney disease or Lou Gehrig's disease. And even children of workers, if they have kidney disease, they could get on Medicare to help defray a lot of those costs.
Okay. Okay. Okay, because, you know, a lot of times I don't think people see the uniqueness of the programs. They don't know all the uniqueness of the program, really.
They're pretty big.
Right, and it takes a person like yourself to come out into the community and tell them, tell the community what is new or what is continuously going on in Social Security. A lot of people just go there and say, well, I'm going to apply for Social Security, or I'm going to apply for SSI, I'm going to apply for SDA, and SSI is Social Security Supplement, right, income.
The Supplemental Security Income Program?
And SDA is Social Security Disability. Okay, okay. So a lot of people are under the assumption when they contact Social Security, they're only contacting them for various reasons, which means they're trying to get money to care for themselves during their ailments, during the disability time frame.
Well, Social Security is a package of programs designed to take care of workers and their families, no matter what situation they fall into, whether it's they're able to retire, if they become disabled. If they pass away, there's money for their loved ones. And then there is, of course, Medicare that I've come to talk to you today about.
So when are people eligible for Medicare?
When they're 65, disabled, or have Lou Gehrig's or kidney disease.
Okay.
Those are the criteria.
The criteria.
Right.
Okay, okay. Had to piggyback on that again because, like I said, we don't want anyone to assume that you have to wait to try to get some type of service or assistance from Social Security. And and a lot of times our elderly clients think that, well, I'm not eligible for these programs, so there's no need for me to contact them.
When in doubt, fill it out. They should always check with Social Security or Medicare, and we'll let them know for sure whether they're eligible.
Okay, okay, so people remember that. When in doubt, fill it out. Okay, well, I tell you what, O'Brien, we're going to take a commercial break, and ladies and gentlemen, get your pens and paper out for some websites and phone numbers from the Social Security Administration in reference to the new Medicare program for January. Thank you. Okay.
Things can get pretty ugly when you're bored. In an after-school program, you can find something way better to do.
And welcome back to the show. For those of you who are just now joining us, we have the Social Security Administration with us, and we have our good friend O'Brien Robinson, who's giving us some insightful information on the new Medicare program that starts in January 2006. So you don't want to miss this. Okay, now this program here that you come to tell us about today, okay, specifically give us some insight on when a person should, what a person should do to apply and when.
Well, they can apply for the prescription drug program as early as November 15th of this year.
Okay.
But the actual prescription drug program isn't effective until January.
Okay.
So there's basically that's it.
Now, if they're applying in November of 2005, will there be some type of notice or something that they will know, or where do they go to apply?
Medicare beneficiaries are receiving notices from now until
Okay.
then. I mean, those who are eligible to get a notice for, or need to know.
Something's coming in the mail?
Something's coming in the mail.
Okay.
But right now, there's an extra help application that's being sent out to 20 million Social Security recipients.
Okay.
So, and people who are eligible for Medicare. So there's a lot of people, in fact, in your viewing audience, probably have one in their hand right now.
Okay.
So they don't want to throw it out. They want to just fill it out as soon as possible. Fill it out with a number 2 pencil or a black ink pen. It's important. And send it in just as soon as possible, because the applications, these scannable applications, will go into Social Security, be scanned, and that's how the process works. So it's
Now, is this
high
program
tech.
mandatory? Is this a mandatory program?
No, that's a good question. It is not mandatory. That's the short question. It's totally voluntary.
Okay.
But everyone eligible for Medicare can enroll in the prescription drug plan as early as November 15th, and then it'll take effect January 2006.
Okay. Now, what will be covered under this program, and what will be the cost?
Well, the details of the prescription drug plan themselves will be coming out in October.
Okay.
So no one really knows what the coverage is exactly. The first date to apply for the prescription drug program, again, is November 15th. In fact, people should be putting that on their calendar because that's important.
Okay.
Don't leave.
Did
Don't
you hear
leave.
that, Mom? Okay.
Don't leave your television set.
Okay.
Put it on November 15th. But there's a monthly premium associated with Part D, and that's somewhere around $37 a month. And then there's also deductibles and co-payments, much like most insurance companies. But if they send in that extra help application that I've been talking about,
Okay.
they may get even a bigger savings with their prescription costs next year.
So what are we looking at? How much money do you think people will be saving?
The average, and this is really good news, the average Social Security beneficiary is going to save $2,100 when buying prescription drugs next year. And think about how helpful that's going to be for our grandparents, your mother, who you just mentioned.
That's right, Mama.
And my father, if he's
Okay.
watching. And then with the extra help, people with limited income and limited resources will save even more money because they will not have to pay for the monthly premium that I just mentioned, the deductibles. And then in addition, they'll also have a small copayment for their prescription drugs.
Okay, now when you say limited income and resources, are you referring to low-income individuals only, or how is that?
No, well, I'm not talking about low income. It's higher than that.
Okay.
It's limited income. And the monthly income has a limit of 150% of the monthly poverty rate. And the resources and assets, like money in the bank, people can have $11,500 as a single person or $23,000 in assets as a couple. So millions of people will be happy to know that, because it's just not for low-income people, this extra help. It's for people with limited income.
Okay, okay. Because I'm sure a lot of our viewers would be concerned that if they're trying to apply for this, what would be the criteria for it? You know, some people won't do it because they say, well, I know I'm making too much money, or I got too much money saved in the bank, or, you know, my husband is still working and he'll
Sure.
be 62 in a couple of months, but still. So the program itself, it doesn't have a cutoff so much based on the income.
The extra help has limits on the income and resources.
Okay.
And there are ways to find out. If they wanted to go on Medicare or Social Security's websites, they have programs there that they could find out, you know, more details. But like I said earlier, when in doubt, fill it out.
Okay.
That's the sure way to find out.
Okay, okay. You know, like I was thinking earlier, Brian, that when these new programs come about, everyone who's putting them together either is a part of the aging, booming population, or has parents or someone that, you know, has an income situation going on, that the medicine is so high nowadays. I mean, my
Right.
father's medicine is so high that sometimes he pays for half of it now to get the other half later, and I'm like, oh, Dad, you shouldn't have to do that, you know. And so the monies that's made for a household is being eliminated due to the cost of medication. So was this program primarily designed for some of the elders, because a lot of them are not taking their medication due to the fact they're trying to pay their bills versus the high cost of medication?
That may have something to do with it. But
Okay.
in addition to people like your father, you know, Medicare is going to, you know, some people will be enrolled in this whole process automatically. People who receive Medicare and Medicaid, or Medicare and SSI benefits,
Okay.
or they're part of the state buy-in programs. They call them QIMBY, SLIMBY, and QI, Qualified Individuals. There's a lot of programs like that. But all of those people will be enrolled first in the extra help application automatically. They won't get anything in the mail except a notice saying
Okay.
that they'll be enrolled. But even those individuals should apply for a prescription drug program that's best for them. They'll be enrolled in a prescription drug plan in November, well, by January,
Okay.
if they don't enroll. But I encourage people to really pay attention to that, because they want to be in a plan that's best for them, that covers their prescriptions, both generic and brand names. So that's very important.
Now that's key too, because people are nowadays concerned when they get a prescription if the doctor has on there brand name prescription medicine or generic. Okay, some people do not want to take generic medication.
Right. And this whole prescription drug program is very flexible in that way. And we'll be getting more information out in October about that.
Okay.
In fact, for those who don't have it automatic or, you know, enrolled, those listeners can actually apply through an extra help application called the SSA 1020.
Okay.
And Social Security is sending out a lot of those. But the reason everyone wants to make sure that, you know, when in doubt, fill it out.
Okay.
They want to make sure it's in soon to find out in October and November that they're going to be eligible, and they're going to know how much money they're going to get, how much extra help they're going to get to pay for the prescription drugs.
Okay, so those who are not automatically enrolled should contact the Social Security Administration.
Well, there's several ways to do that. You know, like I mentioned, we're sending out 19 to 20 million of these extra help applications to people Social Security thinks would be eligible. But they can get these applications at the Department of Human Services, which is the old FIA office.
Okay.
They'll be at senior centers, Social Security offices, and then there's an internet application where if a son or daughter wants to help her, or they themselves want to apply, they can apply online. As it's coming out July 1st.
Is that the SS 1020?
That's the SSA 1020.
Okay.
And the applications, again, if they're having a paper one sent in that's going to be scanned instead of on the internet, they really need to use a number 2 pencil because it's scannable. Don't use photocopies. Don't
Okay.
photocopy it and give it to your friend.
Okay.
That's not.
That's good to know.
Yeah, it's important.
That's good to know. Oh, you didn't get it? Well, I can get you a copy of this and you can have it. So these are, these information they're getting in the mail are scannable, but if you make a copy, does it mess up the scannable one too?
No, it doesn't mess up the scannable one. That person, the original person,
Okay, original person.
theirs will go through.
Okay.
All their friends are going to be mad.
Okay.
So
Did you hear that, listening audience? Okay. Okay, don't share your forms, ladies and gentlemen. We'd like for you to get your original forms, and if you don't get your original forms, then you need to call.
Right.
Okay. Okay. So we're going to give that information out. Well, I tell you what, we're going to take a commercial break, and
Okay.
like I said, get your pens and papers out and get ready to write down these telephone numbers as well as the websites to get this information before November. We'll be right back. Okay.
Plastic ones last longer.
For
pork bellies closed steady due to speculation that demand for bacon-related products.
Read me this one, Daddy.
Okay, honey. The less art kids get, the more it shows. Are yours getting enough? Art. Ask for more. AmericansForTheArts.org.
And welcome back to the show. And where we left off at with some good information about the new Medicare program that will be coming out in 2006. But you need to have your pen and paper ready now to be prepared to take down this information so that you'll be ahead of the game in November of 2005. Okay, now I had to get that out because when this show airs, people are going to remember to write down these websites and phone numbers. So where can they call, or what's the website they can contact?
Well, they can call Social Security's 1-800 number, which is 1-800-772-1213. And I'm sure we'll have it on the screen, at the end of the show.
Okay.
But Medicare has a phone number at 1-800-MEDICARE, which is easy to remember, but I could just say it, 1-800-633-4227. And there's another agency called the Medicare Medicaid Assistance Program. They'll give counseling to people to help them decide which prescription drug plan would be best for them. And that number is 1-800-803-7174.
Okay, that's a lot of numbers, but we'll flash them all. Okay. Now that's the one with the assistance program. Do the individuals go to them, or do they come out to the individual's home and provide the information? How is that done?
Well, the senior centers will have a lot of information. This is going to be huge, and your program really is probably the first program to have any information on this. So it will be rolling out as the year goes on, and it'll be in the newspapers. Everybody's going to have it. These posters will be all over.
First. Okay.
I believe you are first.
Okay, we want to be first. Hear that? We're first. Okay. All right. Well, that's wonderful. I mean, we're glad to have you here and have you come back anytime to give us an update on information with Social Security. And
sure. Thanks for having me.
Yeah, you guys are on our website. Our good friend Sarah Talley always sends us nice information about Social Security. Thank you, Sarah. Okay. Now, moving right along, what happens to the extra help application after it gets sent to Social Security?
Well, several things happen. When they send it in, they don't have to use postage, they don't have to put a stamp on it. It's self-addressed. It's really convenient. Social Security will scan it into the computers at Wilkes-Barre, Pennsylvania. Social Security will send a receipt saying we've received the extra help application to determine if they're eligible, and then we send a determination, let them know if they're eligible. If they're not, we notify them also, and they have appeal rights for that. But those appeal rights will all be in the notice, so it's going to be very self-contained, and that determination's good for 1 year. And if there's not enough information, say they forgot a number on the extra help application, we'll phone them later and get that information from them.
Okay.
Because we want to process it for them. We want to make sure they're ready for prescriptions when the time comes.
Now, if a person has a change of address or whatever, and you sent out this magic letter and they haven't gotten it, do they need to call one of those various numbers you gave and contact the administration itself to get an application sent? Because I'm sure you guys are going to get some return applications that someone didn't receive.
They can always call our 1-800 number, our toll-free number at 1-800-772-1213 and change their address, or go into a Social Security office. And they can also, remember, call Medicare's number. They even have voicemail so that they can call and find out more about the prescription drug plans. And their website, of course, and Social Security's, they're both fabulous websites.
Well, we definitely got to have you guys' website. I know you know your Social Security website. What is the website?
SSA.gov or www.socialsecurity.gov.
Okay.
And Medicare's is www.medicare.gov.
That makes it easier for everybody. I mean, a lot of people are on computers now, so, will those applications be on the computer as well? Can a person download the application from the computer?
Starting January or July 1st.
Okay. July of what year?
This year.
Okay.
And really just shortly from now.
Okay, so in July of 2005, you can get the application online.
Yes.
In November of 2005, you'll get one in the mail.
Details of the prescription drug plans will be out in October with that Medicare and You handbook.
Okay.
And that will be sent to everyone who receives Medicare.
Okay. And the third one, introducing Medicare approved drug discount card. All right. So
Well-
is this more like the application information?
No, I'm glad you mentioned that. The Medicare drug card, which is available right now to help defray the costs and lower the
Right.
costs for drugs, that will be ending because the new prescription drug plan is taking over for that. So
Okay.
that will end when they get the new prescription drug insurance, or at the latest, May 15th of 2006.
Wow. Okay. And this lovely form here, what you need to complete the application for help with Medicare prescription drug plan costs. This has got to be an overall information sheet on what's needed.
Right.
Okay.
It's a great form. People can fill it out and just to see if they're eligible for that extra help.
Yeah, I noticed the back, so you can just fill this out and drop it back in, huh?
We do try to make it easy.
You guys do make it easy. Okay, okay. Well, you know what? I tell you what, O'Brien, this has been a very helpful and supportive segment here, because I know that you're going to get a flood of phone calls. So don't be mad at me if you do. But,
That's great.
A lot of people are concerned about Social Security information, Medicare information, Medicaid information. You guys do a wonderful job, and you're very thorough in providing information.
Thanks. We're here to serve.
Okay, so and you really do. So I'm going to, ask you one more time for some phone numbers, and we're going to air the phone numbers in the website. These lovely posters, ladies and gentlemen. If you don't get the number by way of looking at the website, the show, I'm sorry. Look at these beautiful posters here, and you can get the 800 numbers off of there. And
Yes.
thank you all so much for having a TTY. Okay.
Absolutely.
So my dear friends in the hearing impaired and profoundly deaf community, we have a TTY available phone numbers, and we appreciate that. Okay, along with everything
welcome.
else. Okay. All right.
Okay.
Well, ladies and gentlemen, you know who I am. I'm your host, Marsha Florence with Just Ask. Do at any time send us a letter or a postcard, or email us, fax, whatever you'd like to let us know what you think about the show. Also, those of you who live in different areas and see the show, let us know where you're seeing the show at. A lot of the stations want to know, is somebody really watching the show? And we really do know that you watch the show, because we get emails and letters all the time, and we thank you for them. Keep in mind, we're still working on the Disability Magic Makeover. Those of you who are interested in getting a makeover, send in your letters. Go to our website, justasktalkshow.org, and download an application to send back to us for the Magic Makeover, the Disability Magic Makeover. Once again, I want to thank our dear friend.
My pleasure.
Brian Robinson. Please tell everyone over at Social Security we say hello, and thank you for coming.
Thanks for having me.
All right. I'm your host, Marsha Florence, for Just Ask. What do I always say? If you know someone with a disability, or if you have just a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.